Today we are joined by Karen Whitney, the always lovely Karen Whitney, and Mark Lucas. Maybe not always so lovely, but he is here to join us today. So today's topic, we're going to talk about, people are having bad hair days. People are having a lot of bad days being inside, and this is the first time I think Mark got dressed in a month. So Mark, we appreciate you joining us this morning. So we're going to talk about hair, and we're going to focus specifically on non-surgical hair remedies, solutions, and not all of them. But we're going to talk about lasers. That's really our main thing. But first, Mark, I want to introduce you. So I've known Mark for, I don't know, 15, 16, 17, 18 years, a long time. Mark, I'm going to give you his background a little bit. He came to us when his wife was pregnant, I believe, with twins at the time. And he's been in the hair business for a long time, but it's not because he's been in the hair business. He's had hair loss issues for a long time, starting back in his early 20s. And he lost the majority of hair on his head, and he's been through surgical procedures. He's been through a lot of non-surgical treatments. And he's obviously an expert both from a personal standpoint, and he's the clinical director of our hair loss division. And years ago, Mark, why don't you, let's just start with, we're not going to talk about surgery today, but let's talk about the first devices that we used, laser light-based therapies, and walk us through that process a little bit, if you would.
Yeah, way back in probably 1997, 1998, I remember looking at many different laser devices that supposedly would grow hair back on your head. Unfortunately, these units didn't work properly. I'd pretty much given up hope on any lasers working, but probably around 2003, 2004, read a medical article about a laser called Luce that was from Italy, and apparently they were getting pretty good results with that. I think Dr. Mendelsohn probably thought I was crazy at the time, but we explored what that was all about, wound up purchasing an Italian unit, set it up at the office, and it worked. Typically you would come in 3 times a week to our office, sit under the device for 30 minutes, and typically by month 4, you started seeing some results, and all the way up to 12 months, the hair loss was stopping, the hair was getting fuller, thicker. Dr. Mendelsohn was a true believer at that point. But obviously the negative was that you had to keep coming back to the office 3 times a week for 30 minutes, which is fairly unreasonable. But we had many patients that kept that schedule up and saved their hair.
Yeah, going back to that, so, my view, well, I think a lot of people's views, and I don't know why, well, I kind of know why. With hair loss, you would see men historically, I said we weren't going to talk about hair transplants, but I think there's a stigma associated, not just with the hair loss problem, but the results that we used to get, because we used to put these plugs in, and it would look like what we call doll's hair, or very unnatural. And so I don't know, to a certain degree, it seems like it was kind of a snake oil sort of thing. And so Mark introduced me to this device, and I think it was it from France originally?
It was Italy.
Italy, okay. And there wasn't, I saw some research and some studies on it, but it didn't really impress me. But I will say, we started using it, and like the first 4 patients, all female, who came in with thinning hair, were coming back, and their hairdressers or designers, I'm not sure the appropriate term, were stating to them that they know what are they doing for their hair, and their hair was thicker throughout, and their hair loss seemed to have ceased, or at least was improving significantly. So, yeah, at that point, this device looked like a hair dryer in a salon. I mean, you sat there under this thing, and these diodes, these lights were going off. And as Mark said, it was fairly inconvenient, because we had a number of patients doing this, and you would need to come back 3 days a week is how we did it, because we were open Monday through Friday and during normal business hours. So it wasn't the best setup, but it worked. And I was a believer. I couldn't imagine. And what this was doing very simply, and what these devices do, and Mark will talk about the evolution of this, but is the light-based therapy is basically just increasing the vascularity of the blood flow. We call it neovascularization. And so the hair follicles, let's talk about female hair loss for a minute, okay? Because male hair loss, even though men use this, we're talking about in female hair loss, commonly these days, we don't offer hair transplants. Now, that's not entirely true, but it's mostly true. And so for those hairs that just aren't growing, we want to bathe them in nutrients, which is a good blood supply. And that's exactly what these devices are doing. And so, Mark, go ahead and describe a little bit about how that worked in the evolution.
Well, I remember we were trucking along with several of these Luce devices, and it was working. And sometimes change is hard, but you and I were in a meeting in Miami, and we got introduced to these LaserCap products. And basically, what it was a ball cap with lasers inside, and it was more powerful than our clinical units. And we started exploring, that option, and then, again, it revolutionized our hair industry. For the first time, a patient could actually walk in and actually buy a portable laser unit that was stronger than the clinical units.
And when was that approximately?
Wow. I would probably say it was probably around, 2010 maybe.
Mm-hmm. Okay.
But yeah, I kind of, I fought it at first because, again, we bought these expensive clinical units, and, they were working, and I wasn't ready to switch gears, but, you just couldn't deny the technology. This is, the laser unit is inside of this cap, and you basically turn it on. It's pretty bright. I'm going to turn it on. And, it just bathes the hair follicles in laser light. And basically, when we lose hair, the ones that come back to replace the ones we lost are weaker and finer than the ones that originally fell out. And it's just this endless cycle to pretty much all you're left with is peach fuzz, and then you have nothing. So the LaserCap, which were made, they're made in Cleveland, Ohio by a group of doctors and scientists. It basically reverses that miniaturization. So those weak miniaturized hairs will eventually turn back into a good, strong, healthy, growing hair. So it stops the progression of hair loss and thickens up what you already have.
Okay, so let's just talk. Let's go back a little bit, and I don't want to mix things. I don't want to confuse things too much. And Karen, you can come back here if you like. Hair loss back in the day for men and women, again, are a little bit different. Male pattern baldness we call androgenetic alopecia. There's also a genetic component. We lose the hair follicle. Obviously, there's nothing we can do except replace the hair follicle with some surgical technique. With hair loss for men and women who use this LaserCap, tell me about if there are any medications, and tell me about minoxidil, tell me about Rogaine, tell me about Propecia a little bit. Who's a candidate, when we use it, do we recommend it, and how maybe that's changed from how we used to do things. And
I'm sorry, who did you direct that to?
well, you're right. It wasn't clear. I asked Karen to come back, but why don't Mark? Why don't you go ahead and start it? But I do want Karen's. I know Karen has some things to say about her own personal experience. So go ahead. Why don't you answer that first, if you don't mind?
Well, we started out with Rogaine twice a day, rubbing that into our scalps, and that was to help block, some of the DHT and whatnot that was contributing to the hair loss. But again, with that, it was laborious. Most people, honestly, that use that product, they don't do it properly. They use it maybe once a day. They forget, they run out. So hard to follow the rules, if you will. But as long as you could do it twice a day for the rest of your life, it worked out pretty well. Some people complained of scalp irritation to the point where they couldn't use the product. Then came minoxidil. Well, that was Rogaine. Then came Propecia, which is finasteride. Propecia was a pill that you take every day. And that was a lot easier to do than Rogaine. And I was on it for 5 years with no real issues. And then one day I woke up and my libido, it was gone. And at first I thought it was just, well, I'm getting older. But come to find out, it was because of that medication. So luckily, when I stopped using it, everything went back to normal. And it's probably right along that time we were looking at the lasers more seriously, just because of the issues with the Propecia. But there was a time when someone came into our office for consultation for hair loss, they would not walk out that door without a prescription in their hand for Propecia. But obviously, we're not big cheerleaders for that anymore.
Yeah, I remember. I remember that time period. And so most patients coming in, we would try everything we could non-surgically. And minoxidil basically was an antihypertensive medication that had a side effect of hair growth. Usually, if you use it, for those of you who use it, it's kind of messy, but you can buy it everywhere. If it works, it may grow some hair in the crown area. It's usually very thin hair. So people who are on it, we don't ask you to come off of it. Obviously, anything that works, we want to help you grow your hair back. So it has limited effects, positive effects. And Propecia, Mark just talked about some side effects. And women of childbearing age really aren't candidates for Propecia. So that leaves us with these technologies. Karen, can you share your experience a little bit with LaserCap?
I can. So I was fascinated in the concept of the LaserCap because at my previous practice, we did use LED lights to treat acne and as an anti-aging treatment. And like Mark said about treatments where you have to come into the office, it's difficult to do them frequently enough to really, and long-term enough to really see significant results. But I loved the science and knowing that these wavelengths of light actually upregulated the mitochondrial activity in the cells, and the mitochondria are the energy packets. And so they're really changing cellular activity. And I was totally fascinated because I knew the technology emerged from NASA and looking at how do they stimulate plants to grow in space and how do you stimulate wound healing in space, and then realizing it had these other cosmetic benefits. So aging, losing some hair at my crown, I said, Mark, or at my temples, I said, Mark, do you think that the LaserCap might work for me? Because some of our staff will use it in the office. And turned out he was gracious enough to allow me to use one of the caps. And he tells me I'm crazy, but I wore it on the way home. It's 30 minutes every other day. Wore it on the way home. The next time I washed my hair, there was less hair loss in the shower. I don't think I'm imagining that, but what I've noticed, I've probably used it about 9 months, maybe a year now, but less hair loss with showering, shampooing, and new hair growth. And my hair growth is probably about 3 inches long now, 2-3 inches, and there's a lot of it. And there's enough that I can see it at the temples, but my hairstylist is saying, wow, your hair is feeling and looking so much thicker. So I recommend it to any of my patients who are concerned about early hair loss, because I think it really is it's very easy to use. I just wear it on the way to or from work 3 days a week for a half hour. It's just a little cap you put on with a battery pack. So it's simple. It doesn't mess up your hair. And it's such a great solution because if you can slow down the hair loss, whether you're male or female, and then even have thickening of your existing hair as you're holding onto the hair longer and growing new hair, I think that's a wonderful solution for anyone. So I love the LaserCap. I totally recommend it.
Yeah, thank you, Karen. Wow, that was great. Mark, can you do me a favor? Could you just, I know you showed us a laser. Could you maybe put it on your head and kind of give us a sense? The hat doesn't come with it. The hat that Mark's going to have here. This is his fishing hat, I guess.
Yeah, I like the safari hat better. It's just easier to use. But yeah, I'll just go ahead and put it on. Well, let me get. I look like the dude from the Tiger King. And you really can't see a whole lot with the hat on like this.
So then, Mark,
But
what is it connected to? That cord? Can we see what you're holding on to there, or what?
got a little portable battery pack here.
Okay, so that's why when Karen was saying she can wear it in the car, it's not plugged into your cigarette lighter or anything. You just kind of put that in your pocket or on the seat or whatever, right? And you can move around. And it's portable for people who travel a lot as well. And what is the recommended? I think Karen mentioned it, but what is the recommended usage of it?
We typically go 30 minutes every other day. And, typically, I mean, Karen was really an early responder. Typically, patients don't start seeing positive changes till probably around 4 months. And then from 4 months to 12 months is when, the major changes really happen. But, I wouldn't be doing this at home or in the car. My two almost 16-year-old twin boys wouldn't be doing it here if it didn't work. I mean, we're too busy. But they have hair loss on both. The gene is on both sides of our family. And they've got beautiful heads of hair right now. And the only reason why they're using it is just to keep that beautiful head of hair, because we honestly feel if they use it on a regular basis, they'll be able to maintain the hair that they have.
Yeah, and my wife uses it religiously as well. I mean, she doesn't miss it. If you ever are in our office, you may see our team wearing it, running around, while they're working. So, but any other thoughts, Mark or Karen?
No, it's just good to have the stronger hair. I haven't got that adjusted quite well, but it's got the little LaserCap logo on it, and it just works really well.
Good. Well, all right. I think that's pretty straightforward. I guess the good news is there's a non-surgical, easy-to-use treatment for hair loss. There's not really bad news, but if there is bad news, it's that we don't have a lot of options other than surgery. We talked about some medical therapies that we may or may not recommend these days. We know a lot of people use them, around the world, but these lasers really seem to work, and so that's what we wanted to share with you today. We will be. Oh, yep. Go ahead, Mark.
Yeah, I would like to share that, over the years, as you know, we've tried different products. We've tried different laser caps, and, we get a lot of feedback from our patients. And some of the other products that we used, if something went wrong, the support from some of these other companies just really weren't up to our standards. And I really have to say the doctors at LaserCap in Cleveland, Ohio, they have taken care of any need that we've ever had. Again, this thing has a lifetime warranty. Also, if you're skeptical, it's a lot of money. I mean, typically these things probably on average are about $3,500, and it depends on which model. We typically carry the prescription strength model. But if you try it, and for some reason before 1 year is up, if you don't feel like that you've got a result, which quite honestly that has to be rare, LaserCap will refund 75% of the investment, which is huge.
Yeah, I'll say one thing that happened recently, probably over the past couple of months. There was a patient who came back, and I don't know if it started with, I can't even remember anymore what the reason was. There was some trigger, but she came back. I think, Mark, you can correct me, but it was around 11 months or so. She was on hormone replacement therapy, and she believed that the hormone replacement therapy was a thing that was assisting her with her hair loss problem. So she came back to return the cap, and this was probably one of maybe two. I don't remember in years, honestly, but so, obviously she returned it, and all was well and good, only to discover that she began losing her hair again. And I think within a month or two, Mark, or whatever the time frame was, she came back to repurchase. Obviously, we work things out with her, but it does go to the value of what this is doing, as Karen so nicely explained from a scientific standpoint. So easy to use, and we will have more about hair loss. Yep. Oh, no, there goes Mark again. Okay.
Part of the value of buying one of these from Dr. Mendelson is we encourage you to come back for follow-up treatments. And those that come back for their follow-up treatments typically are happy. Those that don't come in for their follow-up treatments, we just kind of lose them and they're out there on their own. And those are usually the ones for whatever reason feel like, it didn't work. But, there has to be some accountability. And if you're coming in for your follow-up visits, we know that you're using the product. If you're not using the product, it's not going to work.
Well, that's a good point. We also do a scalp analysis. We also do a hair analysis, and there are some other things. As we move forward over the next, 2 weeks here, and maybe beyond, we'll get into a little more detail about some other non-surgical options, and we also will discuss other hair loss solutions, mostly for men, but not always. Women losing their brows and other areas where we want hair. But for now, Mark, if you don't have anything else, I think that we'll sign off until tomorrow. Thank you, everybody, for joining us. Hope you have a nice day, and we'll be back tomorrow. Thank you.
Thank you.